will have a much smaller effect on the actual drive of the wave of transmission, which tends to be in younger adults. And they have not yet been vaccinated, and therefore vaccination will have almost no role to play in reducing transmission in that group for some time, because we haven't yet got to the point those are vaccinated. So if you released very quickly, you'd suddenly get a wave of transmission through younger adults, and that would lead in due course to older adults being infected, and some of them, either because they hadn't had the vaccine or because they weren't fully protected by the vaccine, would go on to get serious outcomes.
Thank you. Just before I bring Aaron Bell in on this point, and then Dawn Butler back. Data clearly has been elevated to have great importance. It was Angela McLean that told this committee that data, not dates, was the approach to take. The roadmap does have a lot of dates. 8th of March, yesterday, schools reopening, 29th of March, outdoor sport, 12th of April, outdoor pubs and cafes, 17th of May, indoor hospitality, 21st of June, weddings without limits. So there are a lot of dates there. If we're to be driven by data, does it follow that if the data is better than anticipated, then we can bring forward some of those reopenings?
Well, I think what Sir Patrick laid out at the beginning was the fundamental reason for having the particular 5-week gaps between each of the stages. The reason is that it takes at least 3 weeks, possibly 4, to get the data and to analyse it properly. And remembering there is at least a sort of 10-day lag before you even start to see cases coming through. And the Prime Minister and ministers have said they want to give people a week's notice before major changes are taken, so that people can make proper preparations either way and don't have to do handbrake turns or sudden starts from absolutely nowhere. So if you do that, then you're not going to want to reduce the time between the various steps. And then if you look at the steps, each one of the steps is actually quite a big step. So this first step, opening all of schools, and that's a lot of things, plus some other areas to be opened up. And that includes the decision for people to meet outdoors, much lower risk, as Sir Patrick was saying at the beginning, but not zero risk. So step 1 is already quite a big step. Step 2, if you look at the list of things that are in that, is a very long list of things. All the high contact things indoors, gyms, retail, very long list of things. Again, a very significant step. You would want to see what the combination of schools plus all of those being open is, and that takes you to another 5 weeks. And then you get another very significant step. Really, the last step is probably the smallest, in one sense, step, but even that has, which is taking all restrictions away. You would want to be absolutely confident that we were safe to do this. And I think a lot of people may think that this is all over. I would encourage them to look at what is happening in continental Europe at the moment, where a lot of countries are going back into rates going up and having to close things down again, having not been in that situation before. And I think it's very easy to forget quite how quickly things can turn bad if you don't keep a very close eye on it. And if I can just give one historical point, I know it's not a looking back thing, but I think this illustrates the point. If you look back to, we looked at the data from yesterday, which is the data we have, 65 deaths, a low rate because it was from Sunday, but excellent that things are going down. We feel very pleased that's going the right way. If we look the same date a year ago, so from the 8th of March, there had been in total 2 deaths in the UK. And by the 23rd of March, we were in lockdown in a very difficult situation. So I think people just should remember that things can turn bad very fast if you don't keep a very close eye on what's going on. So I think that's the reason for taking the steps of 5 weeks for a logical reason, which is around when you can analyse the data. And the size of the steps are each already quite large. And you would really want to be very careful before you loaded still more on each of the steps before you were sure what effect that was going to have.
It's important to look back, and it's important to look at other countries, but it's also important to take account of changes that happen, and the big change is the vaccine. And the striking comparison between this country and other European countries that are having to go back into lockdowns is that we have a much more effective vaccine rollout programme, is it not?
Well, I think to go back to my previous point, if you're thinking about a surge in transmission, remember that the great majority of those who will drive a surge in transmission are not yet vaccinated and will not be vaccinated by Easter. So I think the idea that that is a sort of get out of jail card in terms of a surge of transmission, I think is to misremember where in the age spectrum the drive of transmission is. And it's in younger adults, not in those who have so far been vaccinated by and large. Now, of course, the further down the age range we go, the higher the percentage of the population vaccinated, and particularly when people have had 2 vaccines and a further 10 days or so after the second vaccine, of course, that's going to take more and more of the heavy lifting. And that's the whole point that the modelling shows, which is if you take things steadily and then start your proper opening up, really the biggest risk opening up, when a lot of the people in the lower ages have been vaccinated, then you're in a much better position. But if you start shunting things forward, you will very quickly get to these very high peaks that were there. And I think that's you don't need modelling to understand that the big drive in transmission tends to be in adults under the age of 60. And at the moment, we're only just getting to those who are in their 50s, other than those who've got pre-existing health conditions.
The timing of these measures is clearly of great importance, and this is why all of us are pursuing this, because it's on the minds of members of Parliament, because it's on the minds of our constituents whose jobs depend on this. So just to kind of explore this a bit further, so Professor Andrew Hayward, who we know of University College London, said absolutely right to be driven by the data, but if we're driven by the data, then we need to be prepared, if things are better than expected, that we may be able to release faster than we expect. That is reasonable, isn't it?
Well, I think Andrew would probably want to consider what he meant by faster. I don't think he would at all suggest that we should concertina the 5-week gaps, because that is, if you're giving a week's notice to people, that is the minimum period you're actually going to be able to have data to be able to look at and take a serious judgment. So I think in terms of how long the period between steps are, I think that is a significant. You want to be quite careful. Now let me just read out what is going to happen on the 12th of April. So we're going to have indoor leisure, including gyms and things, libraries, community centres, personal care, retail, outdoor hospitality, lots of things around children, domestic stays overnight, including self-contained, etc. There's a long list of things that are being opened, and you would want to see how all of that opening, which is a lot, and I don't think Andrew would be arguing we should be doing more than that at that stage, interacts with schools, which are now completely open by that stage and back by the time we get to 12th April, we're going into the summer term. And so, what we've got is actually quite large blocks of potential risk all together. And I think actually when you look at that, you'd think, well, what would you want to put on top of that, given that if we, what the government has been told over and again is take this steady, and what we don't want to do is accelerate into trouble and then have to reverse straight back out again, open things up and immediately close them down. That is not what anyone's asking for. So what we should be trying to do is sticking to the 5-week period, because that's when the data happens, and making sure what we have is sensible blocks. And if ministers want to relook at this, of course they can. But if you just think about what's all being opened in April, and exactly the same is true in May, a very substantial block of things with very high risk when you put them together, I think you'd really want to think quite carefully before you load even more onto that. If you're trying to reduce to an absolute minimum the risk, you then have to reverse out of it.